First, we'll welcome Dr. Michael Applegate of Novant Health Neurology. Dr. Applegate, thank you so much for being here today. It's such a pleasure.
Well, thank you for having me.
We're really excited to have you in Brunswick County, but very excited to have the opening of Novant Health Neurology. Yeah. That is a first for this area, and it is it's an awesome thing for the folks who live here. Excuse me. And as we begin, I'd like to learn a little bit more about you and your education and your background. So if you would share some of that with our viewers.
Sure. I was born in North Carolina and grew up in Laurinburg, North Carolina, and then went off to college at Wake Forest University and got a bachelor's degree in biology there. Then went straight to graduate school and did research on memory and aging at Bowman Gray School of Medicine. Got a PhD in neurophysiology there. And then did a 2-year postdoctoral fellowship up at Johns Hopkins in Baltimore. And there I was researching Alzheimer's disease. Stayed on for a couple of years after that as a junior faculty member. And then I decided I want to become a physician. And so came back to North Carolina. Went to the University of North Carolina, Chapel Hill for medical school. And when I finished that, I went back to Wake Forest for my residency in neurology. So.
Wow, impressive. So you have an extensive background in research.
That's true, yes, I did. I spent about 10 years in research.
Wow. Yeah. And a lot of it in memory.
Memory and aging and Alzheimer's disease and those sort of issues.
And that's so needed around here.
Yeah, unfortunately there's a lot of people that have that, yes.
Yeah. But you've also had a great deal of experience in patient care.
Yeah, when I finished my residency, I went into private practice in Ashburn, North Carolina, and was there for about 18 years. So overall, I've about twice as much time spent with patients as I did with research.
Yeah. I'm curious, what brought you to Brunswick County?
Well, my wife's family has been coming to Brunswick County, Ocean Isle Beach since the mid-'60s. She lived in Charlotte.
We hear that so
Yeah,
much.
I'm sure you've heard it before at some point or another. And so when I married in the family, then I was coming to Ocean Isle as well. My parents started coming, and they retired from Laurinburg down to Ocean Isle Beach and have lived here about 15, 20 years. We bought a house a few years ago, and eventually we thought we would retire down this way, but then I got the offer from Novant to come down here, and my youngest of 4 children is a senior in high school, so the timing was right.
Timing's right.
Timing was right, so we decided to come on down. So.
That's great that your family's here. Your parents are here, and that's really nice. And you kind of came back to your roots. You know, you're close to Laurinburg.
That's correct. Yeah.
Yeah. Well, we're really glad that you chose to make this your home. Tell me more, though, about your new clinic and where it's located and things like that.
Yeah, I'm very excited. It's a very nice place. It's on 204 Smith Road. It's right across from the post office in Charlotte. Right. And right next to the newspaper office there. And they've fixed up the building there, and we've assembled an excellent staff, and we've been seeing patients since May 1st, and things have been going very well.
I've met your staff, and they're awesome.
They're great.
Great staff. It's a great office.
Very nice and very efficient. And
it's beautiful. Great parking.
Yeah, there's plenty
easy
of parking.
to get in and out of. It's a great spot.
Yep.
So, well, what types of services will you offer at that location?
Yeah, well, I'm a general neurologist, so I see pretty much a little bit of everything.
Yes.
We haven't gotten everything together quite yet, but we're going to be offering EEGs, which is brainwaves for seizures and epilepsy. And we're going to offer some services for headaches, maybe some injections and that sort of thing. We're trying to get some other services as well, but we'll add them as we get
Sure.
go along. Yes.
Yeah. Well, that's great. I'm curious, what are some of the common types of conditions that you treat?
Yeah. As a neurologist, we see strokes, see a lot of seizures and epilepsy.
Sure.
See a lot of migraine headaches. See neck and back pain when it involves pinching of nerves in the neck. We see multiple sclerosis and Alzheimer's disease and Parkinson's disease, a number of things like that.
I understand that there are some conditions that viewers and I might be surprised that you do treat. Can you tell me some of those?
I think people will be a little bit surprised to know that we treat things like muscular dystrophies.
Really?
Like the Muscular Dystrophy Association with the telethon. Even though there's no nervous in the system, no nerve in that name, we treat those, and we treat ALS, which is Lou Gehrig's disease.
Yeah.
So.
I think that many of the people in this area do drive outside the county for their neurological care. Is it possible to get their medical records transferred into you?
Absolutely. I mean, that's one of the advantages. We have a standardized electronic medical records, and we can get those records in from other outside physicians and able to have it available right away. So it's great.
Oh, okay, great. And I know you're on the Epic system. So
Epic system is, and it's becoming
so
kind of the
gold
standard for the industry, and so that makes it much easier.
Yeah, absolutely. And I know the large New Hanover Regional Medical Center, they're also on Epic, so it makes it, and their physicians.
So quick electronic transfer, and it's very easy.
Yeah. If patients or viewers out there need to make an appointment with you, is a referral required?
It's not required. I mean, it's helpful to have a referral, to have a physician see you and do that. But we take people that don't have referrals. That's fine. So we're able to do that.
So a patient can just call and schedule an appointment.
Call our
For
office
instance, if they have some of the things that you mentioned, they've had a stroke or things like that, they can just call and make an appointment.
Absolutely. We'll be happy to see them.
Okay. Well, I appreciate all this information. There's so much more that I'd like to learn, but for now, can you tell our viewers how that they can get in touch with you to make an appointment?
Sure. You can just call our office. It's 721-4220 and ask to be seen, and we'll be happy to accommodate you.
Well, great. Yeah. Again, thank you so much for being on the show. I want to have you back, though, really soon to see how it's going and talk about some of those other topics.
Sure, I'll be happy to do so.
All right. Thanks again.
Thank you very much.